I would like to congratulate the entire J&J team for achieving this landmark of more than 5 million Technis implantations.
So we have used about 14,000 plus Eyhance lens in the last fiscal. So that's our go-to lens today.
The TECNIS Eyhance has the largest body of evidence regardless of study design or evidence level. The number of published papers, peer-reviewed published papers, is almost double of what has been published, all the other lenses, the monofocal plus lenses put together. And out of the 51 Eyhance studies, 48 focus on intermediate vision and demonstrate a significant amount in 98% of these studies. It's a good intermediate vision. And another important aspect is that when it's compared with any monofocal lens, there is a consistent result in the improved intermediate vision, regardless of the conventional monofocal lens that is checked with.
If you summarize the entire studies in the literature, almost 85% patient will achieve 20-25 vision intermediate, and 30-40% will have with a standard monofocal. See the difference between 30-40% to 85%, and better functional vision without the compromised quality, and uncorrected near visual acuity is also better, almost 1 to 2 line better than the monofocal lenses for these patients.
Everyone loves multifocality, everyone wants to be free of glasses. Once you are able to give something extra to them without any compromise in the quality of vision, they are more than willing to accept it.
In our centers, the go-to lens is a monofocal plus from the Eyhance variety because we have had excellent distance visual outcomes. It has been a glistening free lens. There is nothing wrong with the material. The material is great, low PCO rate, and specifically when you're coming to the toric version of it, it has outstanding rotational stability, and lifestyle wise patients are virtually spectacle independent. So we have used about 14,000 plus Eyhance lens in the last fiscal. So that's a big quantity of the lenses that we use, and that's our go-to lens today.
I was initially wondering what is this going to offer more than what I was already using. So I had my reservations about it, but once I experienced these lenses and then saw that there is a definite benefit in intermediate vision that it is giving, then stuck onto it. And now slowly in the last 5 years it has transformed to my go-to lens. It's almost replacing my monofocal intraocular lens practice almost completely. And when it comes to a comparison with the other monofocal plus lenses, even though they might replicate the little extra intermediate vision that these lenses give, as far as the contrast sensitivity, the quality of vision, the modulation transfer function, etc. is concerned, the TECNIS Eyhance definitely performs better.
We compared 70 eyes, 35 TECNIS Eyhance, and that is the Toric II with 35 of the lens from another company. So when you're looking at these Snell's, there is no comparison. The distance visual acuity was comparable, but when you look at the intermediate and the near, you saw that the Eyhance Toric II performed much better. The near add requirement, according to in our patients, averaged about 1.5 diopters. As I told you, in my pure C, it is 0.75 or something. So here it is between 1.25 to 1.75. In bilateral cases, it's slightly lower than 1.5 as compared to the other one, which is closer to about 2 diopters. I have not had to explant a single monofocal plus IOL ever since I have introduced.
We designed this IIT and investigator-initiated study with J&J. In last 6 months, we have recruited many patients, and patients should have a diabetic retinopathy without any maculopathy or proliferative disorder. And bilateral phacoemulsification with Eyhance implantation was done in these cases. You see here, almost 95% did not report any difficulty for near, intermediate, and distant vision tasks. Around 80% of cases were totally independent from the spectacle, which is a very high number. Only 20% of patients require a near addition, that too in a reading of very fine prints.
Because this lens is not going to drop the visual acuity, the visual quality in any way for distance. I think wherever you can implant a monofocal intraocular lens, where it's a post-refractive surgery scenario, glaucoma patients, patients with early retinal changes, all these conditions which we thought were relative contraindications for multifocals, you can use a TECNIS Eyhance. All that a modern day ophthalmologist would ask for in a intraocular lens. That's the reason that this lens has so quickly achieved this landmark. And these, to my mind, are just the beginning days. And with the various other platforms that are coming in the EDOF version, the torics, the multifocality, the continuous range of vision lenses, etc., I think this is just the beginning. All the very best to the team.